Hello all, my name is Kayla DeSassi, and this presentation is on patient-targeted Googling, a qualitative study of psychologists' perceptions and practices. As I said, my name is Kayla DeSassi, and other co-authors on this presentation are Emily Putnam, Ann Edwards, and Kelly England. The term patient-targeted Googling is a pretty new term, and the definition is when healthcare professionals are obtaining information about their patients by searching patients' names on internet through search engines and social media. Social media like Twitter, Instagram, Facebook, so on and so forth. As I said, patient-targeted Googling is a pretty new phenomenon, and the American Psychological Association Ethics Code lacks the specific guidance on this topic. Furthermore, existing literature on patient-targeted Googling is very sparse and inconsistent regarding the prevalence rates and ethicality of the practice. This project aims to clarify psychologists' attitudes on patient-targeted Googling, examine psychologists' patient-targeted Googling practices, and understand psychologists' training and ethical needs regarding patient-targeted Googling. Now, the individuals who were recruited to participate were clinical and counseling psychologists and doctoral level trainees. They participated in either an anonymous online survey or 1 to 5 virtual focus groups. The focus groups were about an hour and a half long, and participants were compensated with $5 for the survey and $35 for the focus groups. The focus groups were transcribed using audio-to-text transcription software, and the focus group and qualitative survey data was analyzed using NVivo12 software to identify the themes and create a thematic analysis. So in regards to clarifying PTG perceptions, we developed 3 umbrellas of responses. Responses given for clinical impact, ethicality, and reasons to and not to engage in a PTG. Now for clinical impact, responses given that could benefit clinical impact were that it can help build rapport, risk assessment, emergencies, and it can be used as a data collection tool. Now where the responses were given where PTG can have a negative impact on the clinical relationship was that it can introduce bias, negatively impact the relationship, and even worsen client symptoms like worsening their paranoia. Now under the ethicality umbrella, there are 4 subcategories: ethical, depends, unsure, and unethical. The responses given under the ethical umbrella were that PTG can be done upon request or with consent during emergencies, when the information on the internet is public information, and when avoiding dual roles. Under the depends umbrella, those responses were, it depends on a case-by-case basis. Under the unsure umbrella, those individuals thought it was an ethical gray area, or they were torn regarding the ethicality of PTG. Now, under the unethical umbrella, individuals thought that it breached client trust, privacy, and confidentiality. Some of the reasons given to engage in PTG were that it can be used as an information gathering tool, it can be used to verify if a client's story is true or not, or it can be used in risk assessment. Some of the reasons not to engage in PTG was that it can introduce bias, it can be a boundary crossing issue, or it can have a negative impact on the therapeutic relationship. Now the second aim was to examine PTG practices, so even are psychologists doing this? The perceived rates of PTG range from 0 to 90% with a mean of 55%. PTG is rare and situational, but may be done often by some clinicians. Some of the responses given regarding the related PTG practices were informed consent, consultation, documentation, transparency, self-reflection and self-monitoring, and technology's privacy considerations. Now, regarding understanding psychologists' training and ethical guidance needs regarding patient-targeted Googling, most psychologists have received very minimal training or received none at all. They have been largely told by the professors and supervisors that they should just not engage in PTG altogether, or with some exceptions, and they don't even think that their guidance and training that they've received has been helpful, or they feel unable to discuss it with anyone, like supervisors, professors, and colleagues. Some of the ideas for the future that were given were to update the APA Ethics Code to address PTG and other online behaviors, with more disclosure surrounding patient-targeted Googling, and PTG training should be done in graduate programs, and it could be done continuing education. Psychologists' perceptions, practices, and perceived rates of PTG vary widely. Results support a call for guidance from the APA on the topic of PTG and future research that examine client perceptions of PTG.